Hello, everyone. Welcome. Good to have you here with us. Once again, I'm Roger Mark D'Souza. I'm the Vice President of Sustainable Markets at Pact, an international nonprofit that works on global development priorities hand in hand with communities. We have a very robust program in Zimbabwe where we're working on engaging OVCs around climate and health impacts, and we're delighted to share some of the framing and outcomes of the work that we have been doing in two provinces in eastern and southern Zimbabwe through our climate change vulnerability assessments. We think this is a very timely and critical type of programming and intervention. And we hope that you would come out of today's session with a heightened awareness of the importance of considering climate change impacts on orphans and vulnerable children, and some of the tangible examples and ways that we're able to do this. So welcome. I'm delighted that we'll have an opportunity to engage with our colleagues from USAID and one of our local partners from Family AIDS Caring Trust, Pact. I'd like to start by kicking us off today by handing the floor to our colleague from USAID, Samson Chidiya, who is the HIV Prevention Specialist in USAID Zimbabwe. Samson also serves as the focal point for climate change and health at USAID Zimbabwe. So welcome, everyone, and I'll hand it over to Samson for some context and framing for our discussion today. Welcome.
Thank you, Roger. It is my pleasure to represent USAID Zimbabwe on the OVC and climate resilience with regards to how it affects our young people. And I would like to thank our FACT colleagues who will be presenting in more detail the findings from their climate resilience study. So just to give the background, I will talk about the climate change and orphans nexus so that we have some bit of background on the Zimbabwe program. Next slide. So our OVC portfolio in Zimbabwe is actually supporting 255,018 OVCs, 90,000 of whom are males and 164,000 being female. This program is supported through 4,627 community cadres who are working through 738 health facilities in 25 districts, where implementation is done by USAID implementing partners that affect Bantwana, Hospaz, and Mabambo in the areas that are shown on the map. Next slide. Can you move to the next slide, please?
I have actually, but I think perhaps your connection is a little slow.
Yeah, we are there. I think it's because of the geographical locality, and it is also raining here, so that could be slowing down the processes. So this slide shows us the agroecological zones that are in Zimbabwe. If you look to the left, in 1960, we have seen a shift that is now showing more red in 2020. This has correspondingly led to an increase in drought-prone areas as well as flood-prone areas. This is important because we have to think of the potential pathways and synergies between climate change and OVCs. If you look at the drought areas and the flood-prone areas, we can make the link that there is potentially increased food insecurity, and there is also potentially an increase in the prevalence of other infectious diseases. For example, recently we have had a number of outbreaks of cholera in different parts of the country. And this potentially also leads to increased internal and external migration, which leads in turn to some risk behaviors like selling sex. And there's also the potential of disruption or erosion of public and private health infrastructure, including the buildings like clinics, access bridges, which in turn can actually lead to interruption in treatment. And this can affect such health services like art refills and condom distribution. So this nexus between climate change and OVCs, although we cannot necessarily attribute that there is increased viral load because of that, but there are some potential pathways. We need to be thinking about these potential pathways. Let's take a closer look at HIV and climate change. Next slide.
We have moved the slide. Angela, please, the slide has been moved, but it's not showing up.
So from my side, we are still on the agroecological zones. Okay, so if we look at this slide, to the left, it shows the number of children and adolescents who are living with HIV in the OVC program, who are all on antiretroviral therapy. And the total is 23,700, with variations between, with the highest district at the top being Harare and the lowest district at the bottom being Kwekwe. And correspondingly, we also have 39,000 caregivers who are living with HIV aged 18 and above. So if we think through about the nexus that I have been describing in the previous slides, you will see that for these people, there is need for proper water, sanitation, and food security. With insecurity in those areas, it will impact on these program participants who are living with HIV. If we take, for example, food insecurity. Food insecurity can be looked at from three aspects. Availability. If we have droughts and floods, we are likely to have food being unavailable. We can also look at food insecurity in terms of access. When there's a drought and food is generally unavailable, it means people have to buy the food from the market or they have to depend on food handouts. Generally, food prices go up when there is a shortage. So the access will then be limited to a less privileged group, which means those who are living with HIV who are mainly OVC, will not have access. And food insecurity can also be looked at from utilization. Usually when there is a drought or prediction of drought, people tend to grow drought-resistant crops, and these are generally less nutritious than when we have enough rainfall for different crops to thrive. So food insecurity will impact on both on availability, on access and utilization by children and adolescents who are living with HIV. And these, because they are already vulnerable, it actually means that even a small shock, a small drought, or just immediate floods or intermediate floods will impact heavily on them because they are already in a vulnerable position. Next slide.
Please keep going, Samson. Apologies that for some reason it's very slow, but I've moved to the next slide.
Okay, I'll let you know if it comes.
You can go ahead, please.
Not yet, but is it showing on your screen?
Yes, it is. Yes, please continue with your presentation.
Okay, so in response to the climate challenges that I've just talked about, the government of Zimbabwe has outlined the climate priorities for the country as contained in the two documents that are shown. So it is important that as we mitigate against climate change, as we also adapt to the climate change, we use the National Adaptation Plan based on the 6 outcomes that are shared here. We can move on to the next slide.
That is the end, Samson.
Thank you, David. So to summarize, as we engage in the discussion that FACT is going to lead, we need to take cognizance of the fact that OVC and adolescents and children living with HIV are already incapacitated, and any stressors, as those that have been discussed above, will heavily impact on them. Any moderate flood, any moderate drought, let alone severe ones, will actually affect them disproportionately. Thank you.
Thanks so very much, Samson. It's so important to see this heightened vulnerability to OVCs and the potential impacts of just a small shock. So really quite significant. Welcome, Catherine. We're delighted to have you here with us. So Catherine Stratos is the Deputy Director for Climate and Cross-Sectoral Strategy at the Center for Environment, Energy and Infrastructure at USAID. And we're really delighted to have Catherine with us to also provide some framing and context on the importance of USAID's climate and cross-sectoral strategy. So Catherine, welcome, and on to you.
Thank you so much, Roger. Apologies for not getting on a bit sooner, but I did finally prevail with Microteams. So I would like to just introduce you or reintroduce you to the climate strategy, and it was great to have the context of Zimbabwe and how climate change is affecting Zimbabwe. So if we could pull up the slides, I'll just briefly walk you through our strategy. So we developed the strategy in 2021 and released it in 2022, and we're now actively implementing it. And it is a whole of agency strategy, and which means that in addition to the traditional climate work that we've always done in energy, in forestry, and in adaptation, is also being supplemented by work that is being done in all sectors. So to just throw you into it, if you haven't seen it already, we have developed 6 sets of targets, which really shows the evolution of our programming, that we're able to set targets. I think for the HIV/AIDS work, probably the results that we're most focused on is helping people, supporting people to be more climate resilient, as well as really increasing the engagement of populations such as young people living with HIV/AIDS to understand the risks of climate change, as well as perhaps the opportunities for new livelihoods and approaches to lifestyle and really their place in a development context that needs to be both climate resilient and increasingly net positive. So with that, if we could move on to the next slide. What I have on the next slide is our strategic framework, which shows how we hope to achieve these results. And you'll see here that we have, for example, really targeted direct actions where we really are looking at the most critical needs and the best opportunities to reduce emissions and build resilience. We have a great focus on mobilizing finance, as well as working with local communities, Indigenous peoples, amplifying the voices of youth. But we also, in our work, are looking long-term. We're looking we're looking at our 2030 strategy, which seeks to really get some good systems work going, which is really looking at not just the climate critical sectors, such as the energy sector or forestry, or agricultural finance. We're also looking at what does every sector need to do to protect its effectiveness and its future to be climate resilient, as well as how does each sector need to think about what it needs to do to reduce emissions, to have more climate resilient infrastructure. So for every sector to think really beyond, to think even to 2050, what do you need to do to belong into a world that can truly sustain itself in climate change and bring us to that net zero future. I also just want to point out we have a do our part special objective where we as an agency are thinking, how can we reduce our emissions? How can we improve our capacities to respond to climate change from a very operational perspective? And that is also an invitation to our implementers to see what they can do in that realm as well. Next slide, please. So what I also want to just briefly summarize for you is where we are in implementing this strategy. So what have we been doing for the last year and a half? We have been working very much with our sector specialists across the agency, including in global health, to develop sector-specific guidance on how you can appropriately integrate climate into your work. We really have been working with our missions, and many missions now have senior climate champions in their missions. They have cross-cutting working groups that might include, ideally include people from every sector as well as from the operational side of the mission. They have set targets for themselves, for their mission, against those targets that I showed you. They've looked at the results framework and identified where they think they can make a contribution based on their country's development goals as well as the mission's objectives and resources. And that integration into existing activities is happening in many places. And in other places, there's more of an effort to pursue these goals in the new country assistance strategy or in future project designs. And some of our missions are really reaching out actively to the implementers in their community to get them involved in thinking through what can be done as well as how to implement it. So just briefly, we've had some successes. I would say our area of frustration is the funding is not coming through as we had hoped, which makes it all the more important that every sector figure out what it can do to support it. Next slide, please. And these, I just have two examples, one from the food security sector, which we're in Bangladesh, where farmers are getting weather alerts that help them react more quickly to threats to their harvests, and where we really have been able to document that that they are benefiting from it in a very tangible way. So protecting their income where they could have perhaps had far greater losses. Next slide, please. And this one will focus on malaria, and this is very much on the operational side, where our malaria team realized that they were using air freight a lot, and they started using ocean freight. And with that, they have halved the emissions from 2019. So a very, a change that requires planning, but one that is saving resources at multiple levels, and so benefiting them also in multiple ways. And with that, that's really all I wanted to offer here, and to give you an overview of how we're implementing the strategy. There are many ways to pursue, I think, climate work in the broader PEPFAR and HIV/AIDS area. So look forward to a bit of a discussion on that later. And here you see we have opportunities to engage. I'd also like to mention climatelylinks.org as a resource where you can find information. Thank you. That's it.
Thanks very much, Catherine. So good to see the ways in which USAID is becoming a climate agency, and good to see that reminder of this whole of agency strategy, the 6 targets, sort of once again looking at reducing emissions and building resilience in the ways that that is being cascaded at the country level, having the champions and of that ever useful resource of climate links. So really great to have you here. Thanks so much for joining us and for that framing. We'd now like to pass on to a little bit of a conversation that we'd like to have with Tariro Mugundi, who is with Pact, the Family AIDS Caring Trust, and is a livelihood specialist. And she's going to chat a little bit with my colleague from Pact, Eliana Olais, to talk a little bit about the work that Pact has been carrying out. So Eliana and Terry, we'll hand it over to you.
Thanks, Roger and Mark. So yeah, I'm delighted to welcome Tariro Mugundi from Family AIDS Caring Trust that Pact worked with to carry out climate change vulnerability assessments in the Manicaland and Mashonaland provinces in Zimbabwe. So just a little bit of a background, and then we're going to transition to more of an interview style presentation with Tariro. So just to give you a background, the Fact-led consortium implements USAID funded sustaining prevention and increasing access to care and empowerment for orphans and vulnerable children, or we refer to them as OVC, in Zimbabwe. And so the goal of this program is to improve health, safety, education, and stability outcomes for orphans and vulnerable children, adolescents, and youth affected and infected by HIV in Zimbabwe. So this activity was implemented in 9 districts in various agroecological zones in Manicaland and Mashonaland provinces. And it included OVC, their caregivers, elderly, and other traditional community leaders. And it was carried out using both focus group discussions, key informant interviews, and also secondary data that was collected by the assessment teams. And so now I'm going to transition to inviting Tariro to speak a little bit more about a high-level overview of the key objectives and process for carrying out these climate change vulnerability assessments in the Manicaland and Mashonaland provinces. Tari, please.
Thank you, Eliana. Good afternoon. So we managed Expect Zimbabwe, funded by USAID PEPFAR. We managed to conduct a contextual climate change vulnerability assessment that seeks to look into how climate change was impacting the lives of orphaned and vulnerable children, what were the adaptive capacity of the OVC and their families who are most at risk to HIV. We sought to document on how climate change impacts OVC across the 4 domains, the healthy domain, the stability domain, the education, and safety domain. Thank you.
Thanks, Tari. And so I guess looking at those domains a little more closely, what were the major climate change impacts on the safety, stability, schooling of OVC and HIV-affected populations across the provinces that we sampled? Can you talk a little bit more about that?
So what we found was that in the regions that we are operating, the OVC families are experiencing more recurrent cyclones, perennial droughts, and there is an increase in the intensity of dry spells across the 2 provinces. Food insecurity was identified as the major impact of climate change, with further downstream effects. For example, most caregivers in search for greener pastures, in search for economic stability, leaving their children, going to South Africa and neighboring Mozambique, leaving these children exposed to abuse. Parent absenteeism also affects AT adherence, at standing for antiretroviral therapy, resulting in high viral load cases amongst OVC. We also saw that the climate hazards such as floods make roads impassable, and during cyclones as well, affecting the ability of OVC to access their treatment, refills, and other health services. Floods were also seen to increase human-wildlife conflict, in rural areas as children fetch water. So there is a lot of crocodile mauling in rivers in Chiredzi and Checheche areas. Obviously, also are mostly impacted by droughts in rural areas as they have to travel further to fetch water and firewood, exposing them to physical, sexual, and verbal abuse. One thing that also stood out was the post-traumatic stress due to Cyclone Idai that happened in 2018. So most families would say when clouds start to form, it brings a lot of fear and uncertainty. As they're unsure how the floods, how the cyclone will play out. Thank you, and over.
Yeah, that was a very striking example of something that impacted health, OVC health and even their caregivers, right? The kind of pending anxiety when a cyclone or flood would hit, and it was something that we didn't initially think about. And so that was very informative. Thank you for sharing. And another thing that we documented during this process was some of the existing coping strategies that OVC populations and caregiver populations are currently using to mitigate the impacts of climate change. Can you give us a couple of examples of how they're currently coping with these climate change impacts?
So currently, caregivers are adopting some conservation practices under the government-led Fumbudza program that is widely promoting the use of conservation farming and minimum use of resources. We also found the use of indigenous knowledge systems, the use of home remedies, when hospitals become inaccessible, the use of herbs like zumbani, and also some stocking for medicine in case of emergencies. What we also found was that there is a very functional 3 to 6 month multi-dispensing of antiretroviral therapy, and this cushions the families during times of climatic hazards. Interestingly, we also found some indigenous concepts for food stocking and rationing, where chiefs putting together resources to have community areas where they plow and harvest grain that is distributed to the very vulnerable, orphaned and vulnerable children. A concept that, if it is promoted, will lead to sustainable food security in the long run. Thank you.
What about in terms of safety?
In terms of safety, even with the vulnerabilities that we saw, what we found out was that there was very minimal coping strategy. It was quite an aha moment for the community as they realized that their children were facing abuse as they were trying to fetch water, as they were trying to fetch firewood. And some of the suggestions that came out was they were suggesting that if the children can go together to fetch water, if they can go in groups to fetch firewood, it will help in better protecting them when there are these climatic hazards.
Yeah, thanks, Tariro. that was an interesting one, and I think in terms of health as well, some OVCs and their caregivers were using, you know, the the improved cook stoves to then be able to have cleaner cooking materials, and so that was one thing that was expressed that was needed. So I think now we have just a couple of minutes left to talk about some of the recommendations that resulted from these assessments, and specifically how is Pact looking to integrate these recommendations in their programming.
Going on to the
And
recommendations.
Tarira, are you able to
Yes,
come on camera, or is the connection too poor? There we go. Thank you.
Okay, what we saw that what we need to do is to ensure multi-month dispensing of art, maybe up to 6 months, and also mobilization of treatment bags for the community health care workers, where they can issue out basic analgesics in term when they are lockdowns due to flooding or cyclones. And we are also proposing refresher trainings for community health cadres, for community adherence treatment clubs, where they can discuss early warning systems to ensure the OVC community are ready when there are some sort of hazards coming. For example, in this year, we are anticipating a drought that is coming, and already we have been sending out early warning messages that there should be early planting. This helps to cushion the OVC families with the impending drought. We have also integrated climate change packages and tools into the trainings that are existing, ensuring that issues to do with mental health and well-being are also included and are also discussed among the OVC communities that we are serving. We are also looking into promoting the use of the Tsotso stove. A Tsotso stove is a stove that uses very less firewood. They're just like sticks, and this helps to save the environment, the cutting down of trees. It is widely used in Kenya, in East Africa, and they call it the jiko. This is something we've been speaking even to some Chinese and Kenyan companies to see how we can partner together to promote the use of the Tsotso stove. And we are also encouraging the OVC caregivers to continue with their conservation farming practices, incorporating all aspects of climate change. Even we are looking at the children in school to ensure that there's some climate literacy as they are receiving some of the other trainings that they receive in school. Thank you.
And how are you engaging not only government stakeholders, but potentially you know, agriculture companies, for example, to support with these initiatives? And maybe you can talk just briefly, we have a couple of minutes left, on the work that the Climate Resilience Technical Working Group is working on, and kind of how they're using these results to turn into action plans, and who they're involving, the different types of stakeholders they're involving.
Okay, so Pact is also leading the Climate Resilience Technical Working Group for USAID OVC implementing partners in Zimbabwe. And in this technical working group, we have the participants drawn from multi-stakeholders. We have government, people from government line ministries. We have participants coming in from other NGOs that are implementing climate-related work. We have multi-stakeholders. Health is represented, education is there, safety, child protection, line ministries are also well represented in the climate change technical working group. So we have this discussion. Also, the private sector. In our last technical working group, we had a financier, a bank, even coming in to say there is the disparity is even the funding, the lack of free funds to implement some of the strategies. And we were trying to then to draw to say if the caregivers can access some group collateral loans, they should be able to fund some of the climate smart agriculture, climate smart technologies that we are trying to implement. There was a lot of cry for solar products in the communities. It is something that will help for them it's a more efficient energy source going forward. And so we are also approaching solar companies as we are trying to make the OVC communities more climate resilient.
Thank you, Tari. That was great. You captured exactly what I asked. So I think now we're going to transition to a Q&A session. Thank you very much, Tari, for presenting on the findings from the CCVAs.
Great, thanks so very much, Eliana and Tari. And I'm looking if anyone has any questions that you'd like to put in the Q&A, please do so. Tari, we have a question for you, and our colleague Choice is asking whether you are tracking the trends for child-headed households as parents or caregivers migrate to neighboring countries in search of livelihoods. Would you say there is an increase in the number of children living on their own? What are your thoughts, Tari?
Okay, thank you. So from what we saw in the neighboring, these provinces that we're working in, Manicaland and Mashonaland, are neighboring to South Africa and Mozambique, and there is quite an increase in the movement of caregivers out of the country, mainly due to the socio-economic environment in the country, and also COVID that just passed. Many people lost their jobs and their source of livelihood. So there is that general increase of children being left behind.
Wonderful.
We are also tracking through our case management system. We're able to track to see through our child care workers. We're able to pick up on such issues as well.
Great, wonderful. Thanks very much, Tari. Samson, we have a question for you. What other climate resilience interventions is USAID Zimbabwe supporting presently or planning to support in the near future?
Thank you, Rogers. So, as Catherine shared with us today, the climate strategy in USAID is relatively new, having started in 2021. So the first thing that we need to do is to ensure that we disseminate that strategy to all our implementing partners, stressing the point that climate change is real, it is us, and it is bad. And as Catherine also shared, we should focus on two things: reducing the impact of climate change and protecting the existence of our programs, which points to two important things that are mitigation and adaptation. So for us as a country office, we have already moved into this space by supporting the climate change technical working group, of which FACT, represented by Tyro here, is a part of. So we would like to move this beyond the OVC space to the whole health space and also to the whole USAID program space. Of course, there are some programs like in economic growth where they are advocating for climate smart agriculture. But the way I see it is that it is still a bit disjointed. We need a holistic approach, like Catherine has said, where all the offices come together and try to adopt and adapt to the climate change strategy so that it speaks to a holistic approach as a country. So because we are still in a position where the program is still nascent, a lot of advocacy work needs to be done.
Yeah, so the continued importance for holistic approaches and advocacy and evidence around that would continue to make the case really, really important. Catherine, I wondered whether I could ask you a question also. I was very intrigued in Terry's presentation that she mentioned financing. And this is, I know, one aspect that you touched on in your presentation also. And she mentioned banks and group collateral loans. And I wondered whether from your perspective, Catherine, you could talk a little bit about the potential role of the private sector. I know USAID has looked, for example, at opportunities for blended financing, but any thoughts on how we can bring the private sector or other partners in this space, both for financing, but also to improve the impact and understanding of this connection? Any thoughts from you, Catherine? And while we wait for Catherine, I'm not sure, I know she was having some connectivity issues. We'll check in with her. But while we wait for Catherine to respond to that question, Tari, we have another question for you. And one of our colleagues, Machiwana, is asking, from your assessment, what opportunities exist for youth entrepreneurs, very interesting, for youth entrepreneurs to address some of the challenges you have identified through green jobs, climate smart economic empowerment prospects. So any thoughts on youth entrepreneurs and things that they could be doing?
Thank you, Roger. There are various opportunities for youth in the OVC and climate resilience sector. So they can come in. Firstly, we are talking about a lot of climate smart technologies that are still to be adapted by most communities. The sale of solar products, the sale of energy efficient cooking stoves, for example, rainwater harvesting, is also something that if we are able to bring these technologies to the farmers, they will find them valuable. The caregivers, they'll find them valuable, and they should be able. It's something that is a high potential for growth. The other thing is also even just greening the environment. If you are to be into fruit trees, improving on it brings both. For example, you get the fruit you're able to sell. You have managed to have improved in carbon sequestration as well, and those are very much a lot of opportunities that are there in the country. Thank you.
Thanks so much, Tari. So seeing opportunities for entrepreneurship and having a sense of what it means for green jobs, but ensuring that there's a market and opportunities for these entrepreneurs. And I think, Catherine, you're back on. I just want to confirm that you can hear me and that you're able to speak. We had a question for you if you're able. So, Catherine, if you can hear me, just let me know, and we'll ask. We have a question for you. All right, we'll move on, and if Catherine just come off mute when you can, and then we could see how we could engage you with our question. Tari, I wanted to follow up once again on the work that you conducted through the assessment. Was there anything that really surprised you? Was there anything that you and your team did not anticipate?
For us, what really surprised us was the level of post-traumatic stress amongst the OVC caregivers with regards to Cyclone Idai. Given that the districts that we're in were not close to the epicenter of the cyclone, we saw that it was quite surprising. People had lost their relatives that were in the area, and when we went, there was Cyclone Freddy, which had just been announced and had passed. Fortunately, it had passed, and it affected a lot in Malawi. But still, these communities were quite anxious, and they said that they were much scared. Even when the clouds form, they are scared of their children to go to school, and this affects mostly even the children with disability, is that they are the ones that miss school days the most when there are some anticipated flooding.
It's very, very interesting not to underestimate the mental health dimension and how we think about incorporating this into our strategies and our programs. We have just a couple of minutes left, so if I can move to one final question to Samson, and then we will wrap up. And Samson, as you think about our discussion today, and as you reflect on what you know now coming out of the assessment that has been done, if you were to think to 3 years ago, would you have done anything differently with your programming? With the knowledge that you have now, would you have done anything differently 3 years ago?
Thank you, Rogers. So when we look back at our programs, even very recently, we were redoing the OVC program. We have actually redesigned it twice during my tenure at USAID. At no point did we really focus on climate resilience, because we were more concerned with the health outcomes of HIV. The nexus between climate change and all the outcomes that our programs are delivering is actually glaring. So if I were to redesign our programs, and in fact, I'm going to encourage the mission to be thinking more closely about climate resilience for our programs. And I'm actually encouraged because we have got a strategy. So I've got some official backup, because talking about these things without some official position can be a challenge. So I'll be a very big advocate of the climate change strategy, making sure that all our programs answer to climate resilience. And I'm glad, and I actually was laughing when we were laughing that welcome USAID to the climate change advocacy, because you knew we were not thinking about it. Now we are thinking about it. So we are in the same boat.
Good. It's good to have you there in the same boat, and we need to be thinking about our innovative strategies also. So also thinking outside the boat. So good to have you there as a champion. As we wrap up, maybe Catherine, if you can hear us, a final question for you. What are your thoughts on how we could bring the private sector to work with us to address this nexus?
Yeah, thank you. I could hear you the whole time. And it's been a great discussion with the private sector focused on adaptation, really making the business case for why it is in the private sector's interest to protect their production, their supply chain, their workers. Outreach effort. I guess one could start with banks and also maybe even with microenterprise associations. We also, we do a lot of work with insurance companies. Again, that's more important for, say, agricultural production. It's not going to be a cure-all in any way, but definitely, probably. Yeah, and then finally, I would say, anything that's new, of course, people hesitate to invest in, whether it's businesses or banks. So explain the benefits of renewable energy, to explain the benefits of certain ways of cooking. Environment. Often those solutions are very context specific. So a lot of this really goes to informing ourselves, educating ourselves so that we can give appropriate feedback, and also to talk about the issue and open their eyes up to what they can do. So we can all do something, right? So with that, I turn it over to you, Roger Mark, and it was a great discussion, really well-informed speakers. I was so impressed. Thank you.
Great. Thanks so much, Catherine. So as we wrap up today, just, a continued focus on the importance of looking at shocks and how disruptive they can be. We learned today about some coping strategies that have emerged around the trauma associated with these shocks, recognizing that it's important that we continue to think of Indigenous knowledge, that we look at some connections between human-wildlife conflict that emerged and what it means for protecting communities, that we think about messaging when we have early warning signals, and the importance of building the evidence base to make the business case to bring on additional partners. So thank you for joining us today for a rich and engaging discussion. Today's session was recorded, and we will be sharing with you today's recording as well as the accompanying PowerPoint presentations and additional resources. So friends, colleagues, thanks so much for joining us today, and we look forward to continuing this important work, particularly as as we prepare and engage for the next Conference of Parties on Climate Change. Thank you very much. Enjoy the rest of your day, and we look forward to continuing to partner and engage. Thank you, and bye-bye.
Thank you. Bye, everybody.
Bye-bye.